Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Have you ever wondered about the risk of tongue cancer? It's an intriguing question, isn't it? Tongue cancer might not be as widely discussed as other types, but its impact is just as significant. In the upcoming segments, we're going to delve into the causes, identify the signs and symptoms, navigate the realm of diagnosis, explore potential treatment complications, and finally discuss prevention methods. The goal? To better understand this often overlooked form of cancer. So, stay tuned to learn more about this often overlooked form of cancer. Tongue cancer is not as well known as others, but it's just as important to understand its causes. The main culprits are typically lifestyle choices and environmental factors. This includes smoking, which introduces harmful chemicals directly to the tongue surface. Excessive alcohol consumption also increases the risk, as it can damage cells and lead to mutations that result in cancer. Another potential cause is the human papillomavirus, or HPV. This virus is often transmitted through intimate contact and can lead to various forms of oral cancer, including that of the tongue. Lastly, a diet low in fruits and vegetables is another risk factor. These foods are rich in antioxidants, which help protect our cells from damage. Without them, we're more susceptible to diseases like cancer. However, it's crucial to keep in mind that these factors increase the risk, but they don't guarantee the development of tongue cancer. Knowing these risk factors can help us take steps to prevent tongue cancer. Now you might be wondering, what are the signs and symptoms of tongue cancer? Well, there's a range of symptoms to watch out for. The most common signs include a persistent sore throat that just doesn't seem to go away. You might also experience difficulty swallowing, almost as if your food is getting stuck in your throat. Another common symptom is numbness in the mouth or tongue, a sensation that's hard to describe but impossible to ignore. In some cases, there may be a lump on the tongue that wasn't there before. It's not always painful, but it's certainly not normal. And then, there's the change in voice. You might notice your voice becoming hoarse or a change in the way you speak. These changes can be subtle, but they're important to note. Remember, these signs don't necessarily mean you have cancer, but they're definitely worth checking out. Being aware of these signs can lead to early detection, which is crucial for successful treatment. How is tongue cancer diagnosed and what complications can arise from its treatment? This is a question that many may have. The diagnostic process typically starts with a thorough physical examination. This is where doctors check for visible abnormalities such as lumps or lesions. Next, a biopsy may be performed. This is a procedure where a small sample of tissue is taken from the tongue for further examination. Imaging tests, like CT scans or MRIs, can also be used to check for the spread of cancer. The diagnosis doesn't end there. Staging follows, which gives doctors a better understanding of the extent of the cancer and aids in planning the appropriate treatment. Now, let's talk about the potential complications that can arise from treatment. Difficulty in speaking or swallowing can occur due to surgery, radiation, or chemotherapy. Changes in taste are common too, as these treatments can affect the taste buds. However, it's not just physical complications. Emotional distress is a significant part of the journey for many patients. The diagnosis and treatment of tongue cancer can bring feelings of anxiety, depression, and fear. But remember, these complications are not insurmountable. Medical professionals are well equipped to manage these challenges, and there are numerous support groups available to help patients cope. Although these complications can be challenging, medical professionals and support groups are there to help patients cope. So, how can we prevent tongue cancer? Now that's a question worth pondering on. The good news is that there are several proactive measures we can take to lower our risk. For starters, if you're a smoker, it's high time to consider quitting. Smoking is a major risk factor for tongue and other oral cancers. Next, consider moderating your alcohol consumption. Alcohol, especially when combined with tobacco use, significantly increases the risk of developing tongue cancer. A healthy diet plays a crucial role too. Regularly consuming fruits, vegetables, and whole grains can help keep your body in prime condition, reducing your susceptibility to various diseases, including tongue cancer. Lastly, practice safe sex. This might seem unrelated, but the human papillomavirus, or HPV, a sexually transmitted infection, has been linked to tongue cancer. In essence, leading a healthy lifestyle is your best defense against tongue cancer. Remember, prevention is always better than cure. Today, we've learned quite a bit about tongue cancer. We've unpacked its causes, from tobacco use to heavy alcohol consumption. We've identified key signs and symptoms, like persistent tongue pain or a lump. We've delved into the process of diagnosis and the complications that can arise during treatment. Lastly, we've underscored the importance of prevention, with steps like maintaining oral hygiene and avoiding tobacco. Stay informed and proactive about your health, and always consult a healthcare professional if you have any concerns. UMCC, your ultimate medical consultants connectors.